Ancient healing. How to use food, herbs to relieve gastroesophageal acid reflux disease, GERD, heartburn, and esophagitis. My name is Bernadette Yu Hayhurst. I am a registered traditional Chinese medicine practitioner and holistic nutritionist. In this video, I will be talking about gastroesophageal acid reflux disease, GERD, heartburn, esophagitis, and its general symptoms. I will introduce some healing food and herbs used to treat GERD, heartburn, esophagitis in Chinese medicine. I will be discussing the properties of these herbs and foods based on the traditional Chinese medicine model. The recipes for the teas, dishes, or soup, recommended consumption frequency, and when to expect results. We will talk about where to find these herbs, or the food, other general suggestions to relieve the problems, what to do if the recipes don't work, and disclaimer. You are about to learn how I treat heartburn and acid reflux due to esophagitis using dietary remedies from the traditional Chinese medicine. Many of these recipes have been in use in China from ancient times. They continue to be valued due to their effectiveness, proven over centuries of successful use. The main symptoms of GERD: a sensation of burning pain or stuffiness in the sternum area is experienced daily after meals, especially at night. When lying down, the sensation of pain or discomfort increases. While sleeping, acid and food on occasion travels back up the throat, inducing coughing and a burning sensation in the throat. Sometimes getting to sleep is difficult because a heat sensation in the chest causing concern. There are 4 types of esophagitis according to Western medicine: reflux type, allergic type, drug-induced type, and infectious type. In this video, the food and herbs introduced are to treat GERD, reflux esophagitis, and the symptoms induced by the other types of esophagitis. If you are watching this video, the chances are that you are looking for an alternative or natural solution for your problem. You want to be in control of your health. Drugs are the last choice if possible. And you would like to learn how Chinese medicine practitioners assess, diagnose, and prescribe a treatment modality for these types of health problems. Starting approximately 5,000 years ago, the Chinese doctors of ancient times studied food and herbs intensely. They found that some foods and herbs have specific healing properties which can be utilized to treat heartburn and GERD. Our ancestors documented all foods and herbs tested and prescribed, with much empirical data collected. These foods and herbs continue to be very popular today in China and in many Asian countries. In Chinese medical theory, esophagitis belongs to the stomach ache, gastroesophageal acid reflux disease, or you call it GERD. This disease is classified into 2 patterns: 1. Heat, 2. Cold. The dietary recipes are prescribed based on the corresponding pattern. That is, symptoms are grouped to form a pattern. Recipes are created to treat the corresponding pattern of a disease. Let's look at the first heat pattern. The main symptoms are acid regurgitation, burning and heat sensation in the sternum area, bitter taste in the mouth, dry throat, distending pain in the flank area, and irritability. Other symptoms may include insomnia and loss of appetite. The treatment principles are to purge excess heat and harmonize the stomach. Let's look at the first herb. It's called 枳棘, Gardenia fruit. This dry Gardenia fruit is cold and bitter. The main functions are to purge heat, eliminate irritability, resolve dampness, and reduce toxicity. The normal dosage is between 6 and 9 grams. The second herb we're going to look at is called 蛋豆萁, prepared soybean. Prepared soybean is bitter, spicy, and sweet. The main functions are to release exterior from common cold, relieve chest stuffiness and heat sensation in the stomach, and to eliminate food retention, indigestion. When combining with Gardenia fruit, together they treat irritability with insomnia. The dosage to use is between 6 and 12 grams. Let's look at the recipe. We're going to use Gardenia fruit 9 grams, prepared soybean 9 grams, water 800 ml. In a pot, boil Gardenia fruit until 500 ml of liquid remains. Add the prepared soybean and cook until 1.5 cups liquid remaining. Divide the liquid into 2 portions. Take 2 times during the day. How does it work? As I said before, Gardenia fruit is bitter and cold. It cools the stomach and drains heat, which causes the burning sensation in the sternum area. It also relieves irritability, which leads to insomnia. Prepared soybean is sweet, bitter, and spicy. It purges residual stomach heat from the chest and epigastrium. Together, they treat excess heat, which causes the burning sensation in the stomach. When do you see results? The tea should be drunk 2 times per day to relieve the acute burning symptoms. Stop when results are achieved. Resume on symptom reappearing. This tea is suitable for acute burning pain in the sternum area. Contraindication: stomach deficiency cold. When the symptoms can be improved with applying warmth and pressure. Let's look at the second heat pattern. The main symptoms are intermittent distending or burning pain, which is aggravated by stress or emotional disturbances. Fullness and tenderness in the chest area with alternating constipation and loose stools. Loss of appetite, frequent signing and belching, depression, cold fingers and toes. The treatment principles are soothe the liver, move qi, purge heat, harmonize the stomach, astrange the stomach acid, and to stop pain. Let's look at the first herb, 芦根, reed rhizome. Reed rhizome is sweet and cold. The main function is to clear heat and generate fluids. It also promotes urination, vent rashes. When used 60 grams alone. The normal dosage is between 15 and 30 grams. The second herb is called 枇杷叶, loquat leaf. Loquat leaf is bitter and neutral. The main functions are to transform phlegm, clear lung heat, redirect the lung qi downward to stop cough. We also use it to harmonize the stomach, clear the stomach heat, and redirect stomach qi downward to stop belching and acid reflux. The normal dosage to use is between 6 and 15 grams. Let's look at the recipe. Reed rhizome and loquat leaves tea. The ingredients are red rhizome, dry ones 25 grams, loquat leaves 20 grams, water 600 ml. In a pot, boil all the ingredients until 400 ml liquid remains. Divide the liquid into 2 portions. Drink 2 times per day for 3 to 5 days. How does it work? Red rhizome is sweet and cold. It cools the stomach and replenishes fluid to calm the heat sensation. Loquat leaves is bitter and neutral. It descends the stomach heat and directs the stomach qi. Together, they treat both the root cause and the symptoms by descending heat and rebellious stomach qi to stop acid reflux. This recipe is suitable for esophagitis, GERD with burning pain which radiates to the ribs. When do you see results? The tea should be drunk 2 times per day for 3 to 5 days. Stop when results are achieved. Resume on symptoms reappearing. The contraindications is stomach deficiency cold, when the symptoms improved with applying pressure and warmth. Now let's look at the cold pattern that causes heartburn, acid reflux disease, and esophagitis. With the cold pattern, the spleen and stomach yang deficiency generates empty cold, which affects the normal transportation and transformation of food and drink. The main symptoms: acid regurgitation with clear watery fluids, a stuffy sensation in the stomach, poor appetite, cold limbs, loose stools, preference for warmth and for application of pressure. The treatment principles are to warm the middle burner, strengthen the spleen, and harmonize the stomach. Let's look at the first herb, Huangqi, Astragalus. Astragalus is sweet, slightly warm. The main functions are to tonify qi and blood, raise yang qi, boost the defensive qi, and secure the exterior. It also reduces edema, promotes discharge of pus, and promotes healing. The normal dosage is between 9 and 15 grams. The second ingredient is called Hou Tou Gu, lion's mane mushroom. Lion's mane mushroom is sweet and neutral. The main functions are to nourish all 5 yin organs. They are lung, kidney, heart, liver, and spleen. Lion's mane mushroom promotes digestion, strengthens stomach, tonifies deficiency, and kidney essence. It also suppresses cancers. The normal dosage we use is between 15 and 30 grams. Let's look at the third ingredient, 大枣, red date. 大枣 is sweet and warm. It tonifies the spleen and strengthens the qi, nourishes the blood, and quiets the mind. It is used in a formula to moderate and harmonize the harsh effects of the other herbs. The dosage is normally between 2 and 12 dates. Let's look at the fourth ingredient, 母鸡, a hen or female chicken. For this recipe, we specifically call for a female chicken or a hen. We do not want rooster or a male chicken because rooster and male chicken in Chinese medicine has too much yang energy. This soup is already really warming and we want to balance the soup, therefore we use the female chicken. So the female chickens in this soup has warm, sweet, and salty property. It warms the middle burner, benefits the qi, strengthens the body, supplements spleen, and benefits the stomach. The main use is to treat weak constitution, lack of lactation after giving birth, consumptive disease, emaciation, diabetes, and edema. The fifth herb is called shenjiang, ginger. Ginger is spicy and warm. The main functions of ginger is to release exterior and disperse wind cold. It warms the middle burner and stops vomiting. It warms the lung and stops cough. It also resolves toxicity. The normal dosage of shenjiang ginger is between 3 and 9 grams. Let's look at the recipe. Chicken soup with astragalus and lion mane mushroom for cold pattern pain and acid regurgitation. Ingredients: 1 hen or female chicken, approximately 750 grams. Astragalus, 30 grams. Red date, 6 pieces. Ginger, 3 slices. Lion mane mushroom, 100 grams. Water, 3 liters. First, we clean the chicken well. Discard all the internal organs. Wash the lion's mane mushroom, cut into slices. In a pot, we boil the chicken, astragalus, red date, and ginger on high heat for approximately 20 minutes and then simmer on low heat for 2 hours. Before serving the soup, add the lion's mane mushroom and cook until done, approximately 2 to 3 minutes time. You discard the astragalus and serve the soup with all the remaining ingredients at any time during the day. How does it work? This soup is slightly sweet, which has a strengthening and harmonizing effect. Stop pain. Sweet is used when there is a deficiency, uncoordination between spleen and stomach, and pain. Other uses include constipation due to intestinal heat and cough due to lung heat. Most ingredients in this soup enter the stomach and spleen channels to strongly regulate and strengthen the digestion. The goal of this remedy is to correct a weak organ and to improve the functions of the stomach so that it produces gastric acid accordingly and stops acid reflux. This recipe is suitable for GERD, esophagitis, with sensation of stuffiness in the sternum area, with preference for the application of warmth. When do you see results? The soup is recommended to be taken 2 to 3 times per day on a regular basis, along with other young energy-strengthening dietary remedies. When the body or the organ is deficient, the symptoms tend to be prolonged. Therefore, we suggest that the person continue with this type of diet when symptoms reappear. Contraindication: stomach heat, symptoms aggravated by ingesting warm or young energy-strengthening food. Where can you buy these wonderful foods or herbs? The foods and herbs I mentioned in this presentation are very common in Chinese culture. Many Chinese supermarkets will have these foods I have mentioned, and some can be found in the Chinese specialty stores which sell dried herbs and foods. Most herbs can be found in herbal store. You may have to ask for assistance. To relieve your stomach pain or acid regurgitation problems, I have other general suggestions for your lifestyle changes. First of all, you would like to eat small meals, and after eating, you do not want to lie down immediately to avoid pain. Also avoid late night snacks. Certain foods such as mint, chocolate, alcohol can make symptoms worse because they relax the valves between the esophagus and stomach. Avoiding spicy food, acidic fruit, and coffee. Acidic fruit would include tomatoes and oranges. Avoid smoking, and possibly losing weight may help as well. What have you learned in this video? We have looked at how simple herbs and foods are used in traditional Chinese medicine to effectively relieve symptoms resulting from GERD, esophagitis, and heartburn. We have learned that, as diagnosed in traditional Chinese medicine, the diseases have two main patterns: heat or cold, based on Chinese medical differential diagnosis. We have learned that to treat a pattern in Chinese medicine, we identified and grouped the symptoms. By identifying the pattern, we can use foods and herbs appropriate to that pattern for their specific healing properties in order to cure the disease or to relieve the symptoms. Disclaimer: in Chinese medical theory, dietary therapy is the most basic remedial approach used to treat one's disease. This approach has been used with great success for over 5,000 years. It is suitable when the disease has just emerged and has not caused organ damage. In many cases, dietary therapy alone may eliminate the symptoms completely or prevent the disease from reappearing. Otherwise, other Chinese medicine modalities may be required. For these, you will need to consult with a traditional Chinese medicine practitioner for a complete treatment plan. My name is Bernadette Yu Hayhurst. I'm a registered traditional Chinese medicine practitioner, acupuncturist, and holistic nutritionist. I grew up in Hong Kong and was exposed to traditional Chinese medicine since childhood. For generations, my family uses Chinese dietary therapy on a very regular basis. After I get my degree in a university and a diploma in information technology, I completed a 5 years hands-on advanced Chinese medicine program and also trained as a holistic nutritionist. Following completion of my traditional Chinese medicine studies, I continue my education by attending numerous seminars and workshops offered by world-class R.TCMP doctors from China, who practice and teach in Canada and in the US. As well as practicing Chinese medicine, acupuncture, and nutritional consultation, I lectured on Chinese herbal medicine in a traditional Chinese medicine school in Canada. My special interest is in dietary therapy, herbal medicine, and in teaching traditional Chinese medicine. I am available for consultations by booking only at my clinic in Mississauga, Ontario. I can also be contacted for the phone consultations. Please visit my website for details: www.acupuncturemississaugaclinic.com. This video was created as a result of the vast interest in this subject expressed by the audiences at the seminars I have given in a local venue. Recipes provided in these videos are carefully selected and are not the only recommended recipes for any of the disease patterns. I hope by sharing my knowledge, I will be able to help more people like you, the viewers of this video. I enjoy sharing information regarding Chinese medicine, nutrition, and diet. More recipes are available on my website. For any questions regarding this presentation or for making an appointment with me, please visit my website, acupuncturemississaugaclinic.com. I'm also setting up a website, ancienthealingrecipes.com, and the website will have a lot more information about herbal medicine and dietary recipes. Thank you for watching. I wish you a healthy and happy day.